The 20th of July 2014 will remain a day that can never be forgotten in the history of Nigeria's healthcare system. A day the Ebola virus disease was imported into the country for the first time. The Liberian-American man who came in with the disease passed on, but he left behind a national health emergency. How well is this emergency situation being addressed? What is the difference between you having information and using it correctly and you being panicky over the Ebola virus? That's our outlook for today as we find answers to these and other questions. Do stay with us on Channels Television. Almost a dozen people have been confirmed to have the Ebola virus disease, with death recorded in Nigeria. In the midst of this unfortunate situation, a lot of misinformation is out there in the public. The Minister of Health, Professor Onyebuchi, and his counterpart in information, Labaran Mako, were in Lagos, and they gave out tips on prevention, what to do and what not to do.
Some evil-minded persons claiming that ordinary water with salt will cure Ebola virus disease. This is complete lie, total fallacy, wicked lie, wicked rumor. We are going to go back and discuss with the appropriate authorities and look at our laws. We need to fish out these people and they have to be arrested, they will be prosecuted. There's no need for us to complicate matters for this country. We have a problem, we have an imported case, which now we are suffering from the complications. There is no evidence, there's no truth. It doesn't make sense that when you pour water on yourself and rub salt, if anything, you're going to have other problems. Let's manage with Ebola virus disease. Don't give us non-communicable disease, please. Government is doing everything possible with all its development partners. One of the challenges is getting volunteers and getting all manners of health workers. We need doctors, we need pharmacists, we need nurses, we need laboratory scientists, we need those who will do administration, we need those who will be in the security. We need everybody who wishes to volunteer, will train you, you're going to be part of this. Government also approved that all those participating in the care of Ebola virus disease patients and also even participating in contact tracing, all those part of the team should enjoy life insurance provided by government. I understand that Lagos State government also have offered the same. We want to thank Lagos State for that. But federal government has also said that all the workers participating in this will be covered by insurance scheme. There's also additional package of incentives to encourage those who are taking care of Ebola virus disease patients, as well as holding themselves out to do the contact tracing.
This war is going to be defeated in two fronts. The first front is the medical front led by the Minister of Health and all our specialists and professionals around the country and around the world that have come together to fight this disease, to help us in fighting this virus. The other point that must be made is that the health specialists on their own will not be able to win this war except the media take the front seat. We are indeed the people who reach out to Nigerians with the messages, with the knowledge, with education and enlightenment that will enable them prevent the spread of this virus, prevent their families, prevent all the institutions and public places through appropriate behavior, by avoiding risk behavior. And as we have seen continuously, the message on what Ebola is, where you can contract it or how you can contract it is already out there. What we are doing is to partner with the health specialists in the Ministry of Health to ensure that the messages that go out are professional, not messages that will cause panic, not messages that will lead to stigmatization of those who have been unfortunately in contact with those sick or those infected, but messages that will call forth public cooperation, public sympathy, with those infected, and also inspire them to cooperate with health specialists to ensure that they report where they have high fevers or symptoms that look like Ebola virus disease. What we don't want is a situation where those infected will think there is a stigma. There is no stigma. And as the Minister of Health has said, the earlier you report, the better for your health. For example, what we have had here is that all those who reported early or obese health specialists are still surviving. 1 or 2 cases where people left advice and went away, we had 1 casualty. So what we need is for those infected to make themselves available quickly to a health facility, to cooperate with health officials. If you don't do so, there are 2 dangers. The first danger is that you miss the early care that will save your life. And so it becomes more difficult for any doctor to help when the disease has already gone so to advanced stage in you. So the earlier you report, the better for your own health, for your own survival. The second is when you fail to cooperate and you leave a health facility and you run home, what you are doing is, 1, you are not only endangering your life now, you are endangering the life of your family members. People that die of Ebola, the dead body could be very infectious and could indeed lead to infection of several people in the community where those dead bodies are taken to, especially when they are not properly treated. It is important not to take in dead bodies from those countries. This is banned. We want to use this opportunity once again to call on our aviation authorities to clearly instruct all airlines, that operate between this country and countries infected, not to transport dead bodies until they have specific clearance from the Nigerian health authorities. The third point I would like to raise is that huge prayer places where our people go to seek God, where our people go to pray for this country, and prayer is very crucial. We all here believe in God, and we know that God is there, and we know that God still does miracles as he has always done since the creation of the world. So we're not doubting miracles at all. But now, with Ebola, our sincere caution is that anyone infected with this disease should stay at home and be prayed for. Not really at home, stay in a quarantine facility so that we can pray for that person.
Aside from hand washing with soap and water, the Minister of Health adds these tips on personal hygiene and what to avoid.
The same thing we have in bleach. You mix it in bucket of water. You can have this plastic buckets with a tap. They do sell them. Or even you can construct yourself. Big plastic buckets, put a tap. They fill in water and put this bleach, and people just use it to wash hands regularly. It's also cheap. They are doing it in Liberia. We can learn from other people too, as we are also teaching other people. Please, gloves for the public is not. We discourage it because we just be collecting this and putting it in the house. Please. Then the special gear, which we call personal protective equipment, is not for Nigerians now to begin to dress as if they want to go to mass. No, it's not for you. It's for those who are taking care. Hospital workers who are taking care of Ebola victims.
Nigerians should be careful in this season about the kind of messages quacks may be circulating. That is why you should not take anything serious until it comes from Ministry of Health or Federal Ministry of Information or the Ministry of Health of the state governments. Any story you see from a radio, television, if it comes from a program on television where doctors are speaking, health specialists, believe it. But don't take stories from quacks using mobile phones and social media circulating messages that may not be true.
If you have need for more information, here's the way to go.
www.ebolaalert.org www.ebolaalert.org.
That's the website.
The website is an interactive website, and you even get the links to Facebook accounts, Twitter accounts. They're all there.
They can do live chat.
Live chat.
They can do live chat. Then phone number, toll-free phone number 0800 Ebola Help. 0800 Ebola Help. Twitter account at Ebola Alert. At Ebola Alert is the Twitter account.
Meanwhile, the Emergency National Council on Health meeting has resolved, among others, that state governments are to institutionalize communication strategy to ensure mass awareness creation and sensitization for individuals and communities on the Ebola virus disease. The awareness will be with particular attention paid to vulnerable groups such as market women and other women groups, patent medicine vendors, road transport workers, fishermen in the riverine areas, hunters and bushmeat sellers, school children, morticians and mortuary attendants, traditional healers and faith-based groups. The Council also directed the Federal Ministry of Health to provide state ministries of health and the HHSS FCTA, as well as military and paramilitary groups, with support to strengthen training of healthcare workers at the state and local government levels on proper infection control and the EVD containment strategies. The National Council on Health is the highest policy-making body in the health sector and is comprised of the Minister of Health as the chairman, the Minister of State for Health, the Commissioners for Health in the state, and the Secretary of Health and Human Services in the Federal Capital Territory, Abuja, as members.